My name is Casey Jones. My student ID number is 3417644, and this is for the fall 2019 semester. For this video clip, I will be demonstrating how to place a dog into lateral recumbency in order to perform lateral saphenous venipuncture. Lateral is pertaining to the side of the dog, and recumbency means lying down, so therefore lateral recumbency means lying down on its side. This is the best restraint for the lateral saphenous vein because the lateral saphenous vein runs on the lateral aspect or the side of the back legs right here. I'm going to maintain safety by having a noose leash around his neck. My front arm is going to come in front of the neck here, in front of the chest, and grab the leg that's closest to me. My other arm's going to come along the pelvis and also grab the leg that's closest to me. I'm going to pull him down onto his side just like so, gently rolling him down my body. My front arm's going to act kind of as a brace against his neck so he doesn't try to get up, and then both arms are holding onto the down legs so that he doesn't try to propel himself back up into standing. Then to occlude the vein, my thumb is going to come in front of the stifle to extend the leg out, and my back fingers are coming around the back of the stifle to occlude the vein. You can see it popping up along right here. So extending the stifle and then applying some pressure to occlude. And then once given the okay, you can slowly release the pressure, release the restraint, and allow the dog to come back up into standing, maintaining hold of the leash. For this video clip, I will be getting Chief into the sternal recumbency in order to perform cephalic venipuncture. Before getting started, since he is on the table, you want to make sure you have control of a leash. I've got the noose leash on him in case he decides to try to get away from me. And then, like always, you want to gauge the animal's behavior. Make sure that if you need an extra set of hands to help you, that you have the extra set of hands for your protection and the animal's protection on the table. To get into the sternal recumbency, sometimes you can ask your dog to sit or lie down into the sternal recumbency position. For this demonstration, I'll be demonstrating to get him into that position. If you apply some light pressure to their hips and often tilt their head back. All right, let's go sit. Come on. Good job. They'll sit for you. And then you always want to make sure that you have control of their head, so that way they're not startled by the movement. You are protected if in case they decide to try to bite, and to kind of help them feel a little less nervous of the situation. In a typical hold, I would just kind of protect the head here and slowly hold onto their front legs. I applied a little bit of pressure to their shoulders here to get him into the lying down sternal position. So this is the sternal recumbency, where he's kind of sitting up like a sphinx. And so then for the restraint for the cephalic blood draw, the cephalic vein runs along the front of this leg, kind of almost in the crook of the elbow here. And so I'm gonna hold on to his head so that I have adequate control of his movements. And I'm just kind of holding his head in the crook of my elbow to prevent his head from moving. I'm not squeezing or holding on too tight. That's restricting any sort of airway. I'm just simply holding his head out away from the possible technician or doctor that will come and do the blood draw. I'm just holding his head up here, still have control of the leash. And then it's best to do the blood draw on the leg that is opposite from you. That's the easiest way to perform this. And so we're gonna do a blood draw on this left leg here. To get started, good boy. My thumb is gonna come over to the front of the elbow here. Because the vein does kind of run into the crook of the elbow, I'm going to basically roll the vein, good boy, to the outside. It makes it at least a little bit easier access for the venipuncturist that comes in. My other fingers here in my palm of the hand is holding the back of his elbow. This will also help maintain the leg extended for the venipuncturist that comes in, so that if he tries to pull away from me, I still have hold of his elbow. So once again, I'm using my thumb here to roll the vein out, and then the vein is occluded and should stand up here for the venipuncturist or the technician or doctor to come in and to perform the blood draw. Got good control of his head. My body's kind of providing a little bit of weight on him so that he stays in the sternal recumbency. And I'm currently occluding the vein here, ready for the blood draw. The doctor or technician will come in and perform the procedure, and then once you've gotten the okay that he's good to go, we've got the blood sample, I'm just kind of slowly letting go of the restraint. I'm still holding onto his head in case he decides to pop up from the position, but he's a pretty good boy, so he'll probably just hang here for me. And then I've kind of slowly released restraint from him so he has the option of sitting or standing up, but I still have control of the leash so he doesn't jump off the table, and I'm still kind of hovering around his shoulders here so he doesn't try to jump off the table. For this video clip, I will be demonstrating how to place the cat into lateral recumbency in order to perform the medial saphenous venipuncture. Before getting started, you want to make sure you have adequate control of the cat for your safety and for the pet's safety so that she doesn't try to jump off of the counter. I'm kind of hovering around her shoulders here and her head. It's just me and her right now, and she's being pretty good, so she's staying pretty still for me. And you can have her carrier close on hand in case she decides to try to escape. We can put her safely in her carrier, and then always gauge the animal. If they get too wiggly or too fractious, you might need an extra set of hands. Paisley will be good that I can just do her by myself today. To get into lateral recumbency, lateral is pertaining to the sides, and so she'll go on her side in the recumbent or reclined position. To get started, I'll do just kind of a light scruff on the base of her neck here, and then I'm using my forearms on both sides just kind of to act as a brace as I move her onto her side here. And I was having control of the legs here just as an option in case she doesn't have front paws, but also just to kind of help me get her into the side position. And then from here, I am basically grabbing hold of the back legs. It's easiest to have a finger in between so you can restrain both of the back legs individually, and I'm having my forearm here acting as a brace against her spine so she can't wiggle away, and I can kind of keep her taut and in position. And then for the medial saphenous venipuncture, I do have to change my restraint here a little bit. The medial saphenous vein, medial towards the midline, means it's on the inside or the middle, on the inside of the legs here. So I'm gonna just basically hold on to the top leg and her tail so her tail doesn't get in the way, and then the technician will come in and grab hold of the bottom leg to extend it for the venipuncture, and so this vein runs up and down the leg here. And then I'm still holding on to the scruff and her tail and top leg. I'm just extending my hands here and applying some light down pressure to occlude the vein and have that ready for the venipuncture or the blood draw. They would go ahead and draw the blood, and then once given the okay, typically then what would happen is my hand would cover the area that the needle punctured through the vein for a second there to make sure that the bleeding stops. Otherwise the legs would be released. And then from here, once we have the okay that blood is all, we've gotten all of the samples we need, still kind of hold on, hover around the head and the shoulders, just so you have adequate restraint still, or at least in case she wants to try to get away or jump off the table. And so I'm just hovering around her. She has the option to roll up into a kind of a sternal position here, and then we would put her in the carrier once we're done. This video clip, I will be demonstrating how to place a cat into sternal recumbency in order to perform the cephalic venipuncture. Sternal is pertaining towards the sternum or the breastbone of the animal. Recumbency is lying down, so therefore sternal recumbency is lying down on their chest, on their sternum, kind of up like a sphinx position. This is the best positioning for the cephalic vein because the cephalic vein runs along the cranial aspect or the top of the arm here, kind of into the crook of the elbow. So if he's standing, I'll tuck his pelvis under my arm here and apply some pressure on the shoulders down into the sphinx position. And then I'm gonna apply just a light scruff at the base of the neck. My other arm's gonna come and extend the arm forward. My thumb's gonna come on the top of the arm, apply some pressure to occlude, and then roll the vein in order to stabilize the vein and to occlude for the blood draw. And then once given the okay, you can go ahead and release, slowly start releasing the animal, kind of maintaining control still of the head so that the animal doesn't get lost into the treatment area.